I spoke with my GP, and I'm a former smoker. We decided to do the screening, and after the screening was done, they found a tumor on my left lung, and had it not been for the screening, the tumor would have never been found. I wouldn't be really here today had I not had that CT scan done.
One of the big problems with lung cancer is it's asymptomatic until it's advanced, and the vast majority of cases nowadays that are found are advanced and not curable at the time they're diagnosed.
Anybody who's been a long-term smoker should consider lung cancer screening. The reason is that if we catch lung cancer at an early stage, it's very treatable.
Lung cancer screening really is a major breakthrough for lung cancer. 90% of cancers detected by CT screening are stage 1.
The main thing is if it's early stage lung cancer, it's absolutely treatable and curable.
And importantly, much more likely to be curable with minimally invasive surgical techniques, with smaller incisions, shorter hospital stays, and quicker recovery times if we can find it early through the screening program.
Compared to a more advanced stage lung cancer where there are treatments, but much more difficult to cure.
To be a part of the program, first you need to meet with a healthcare provider to discuss the program, to see if you are an appropriate patient.
We start with a shared decision-making visit, which is us coming together and talking about the risks and the benefits of the program and how the program is best suited to you individually. And we give them the guidance of a dedicated healthcare team who will work with them to provide a plan of care and see them through the process.
Patients qualify for lung cancer screening if they're between the age of 55 to 80 years of age, if they're a long-term smoker, that means 1 pack per day on average for greater than 30 years, and if they are a current smoker or if they've quit smoking, if they've only quit within the last 15 years.
You must not have signs or symptoms currently of lung cancer, and the two things that we're looking at are you are not coughing up blood and you have not had an unexplained weight loss of 15 pounds or greater in the last 6 months.
As those can be signs of cancer, and they still need to come in and see their doctor. They still need to be evaluated, but the type of scan that we might do for those individuals is different than the low-dose scan.
They should also be free from any active lung infection, as this might lead to false positives or having to repeat a test unnecessarily.
Well, it's important to remember that most of the findings on CT that are abnormal will turn out not to be cancer. If you have a finding that is suspicious for lung cancer, your physician will be notified and you will be notified.
We work with a team of physicians at all of our sites, interdisciplinary team of specialists that involve pulmonologists, thoracic surgeons, oncologists, nurse navigators, and your personal physician to coordinate your care.
So if the biopsy shows cancer, the next step will be for us as a team of physicians to recommend an appropriate treatment. In some cases that would be surgery, in other cases it might be something along the lines of chemotherapy or radiation. In some cases all three of those will be used. Some people might be concerned about what might be found. It's just always better to find it early than it is to find it late. We've already had multiple patients who were found to have early stage lung cancer who've had resection.
If you're a smoker, a former smoker, it's an opportunity to check the health of your lung. Unfortunately, mine was not healthy and I had to have surgery, but it saved my life.
At the Cone Health Lung Cancer Screening Program, we believe in empowering our patients with knowledge, understanding, and guidance. We want patients to know whether or not they have something to be concerned about inside their lungs. And if we do find something, we want them to fully understand what's there and what the treatment options are available for them. If indeed there is something to be concerned about, we want to help guide them through every step of the way. You are not alone. We're here to help. If you are a long-term smoker, pick up the phone and give us a call. We're here to help you take charge of your future.